Number one, according to Solomon Ash's conformity experiment in 1951, people conform primarily due to deeply human desires to fit in and a compelling sense of social pressure. The experiment demonstrated that individuals are willing to ignore the obvious truth and agree with the wrong answer provided by a majority group of peers. This extreme tendency to conformity led Ash to famously state that reasonably intelligent people are willing to call white black simply to align themselves with the group and avoid social disagreement. 2. What factors contribute to people administering electric shocks even when they knew it would cause harm to the participant in the Stanley Milgram study? The Stanley Milgram study found out that extreme willingness to administer electric shocks was rooted in the subject's obedience to a perceived authority figure, which Milgram linked to the "I was only following orders" defense. Factors that contributed to the high level of compliance included legitimacy of authority, which is the experimenter was dressed in a lab coat to signify authority. Institutional reputation. The study was undertaken and sponsored by a highly reputable institution like Yale University, which reassured subjects that the experiment was legitimate and above board. Perceived obligation. Subjects felt the sense of obligation to the experiment because they had volunteered. Assurances of safety. The subjects were reassured that although the shocks were painful, they would not cause permanent damage. Path of least resistance is refusing. The experimenter created a conflict. Siding with the experimenter and continue the shocks was often the perceived path of least resistance in the situation. Number 3, explain how stereotypes can lead to medical abuse and misdiagnosis. Stereotypes and bias in the medical system lead to abuse and misdiagnosis by causing healthcare professionals to view black patients' bodies and compliance differently, often leading to dismissiveness or neglect. The video highlights misdiagnosis and dismissiveness by assumptions about a partner's patient's life choices, aka sexual history, and etc., can lead doctors to ignore patient-reported symptoms, resulting in misdiagnosis. Neglect and abuse. Patient pain is often dismissed, resulting in failure to run necessary tests. Stereotype of drug seeking. One patient was refused more pain medication after a procedure because the doctor didn't want her to develop a habit, implying a stereotype of a black woman seeking drugs. And focus on biological flaws. Is historically and currently the medical community views blacks' bodies as inferior or different. This shifts the focus from systematic causes of illness to perceived biological susceptibility, thereby excusing the medical system's untrustworthiness. According to our notes, what are the 5 steps in making decisions to help others? 1 is noticing the event. The bystander must first become aware that something is happening, interpret the situation as an emergency, which is the bystander must define the situation as an actual problem or emergency requiring intervention. Assume personal responsibility is the bystander must feel personally responsible for intervening. 4, know how to help. The bystander must determine the appropriate way to offer assistance and implement the action choice, which is the bystander must act on their decision to execute the chosen form of help safety.